Welcome to Empowering Seniors. I'm your host, Katherine Ambrose, and today I'm speaking with Amy Cameron O'Rourke about her book, The Fragile Years, and on this episode, we're going to be focused on money. Amy, welcome to the show. Thank you so much for coming to Kansas to talk about your book, The Fragile Years. So tell us what the fragile years are.
So the fragile years is a stage. So in your mind, if you're listening, you see the terrible twos, midlife crisis. The fragile years is the stage when you're somewhere in your 80s, you start moving a little slower, and all care is rendered differently in this time than all the years previous.
I think it's such a brilliant name, The Fragile Years, because it encompasses where we're going. If we get the opportunity to live out a natural life, that's where we're going to just naturally end up. It could be in your 80s, it could be in your 90s or over 100, but for a lot of people, it's their 80s.
Yep. And I love the word fragile because it's like a little fragile bird. It's a beautiful term to me. And what I like people to think about is in that time of life, you're moving slower, you're walking slower, you're thinking slower, you might be eating slower. And so when you see your parent or yourself moving slower, or you're not doing things that you used to love to do as often, you're probably entering into the fragile years.
So money plays a huge part in the fragile years, I know from your book. And I know from talking to viewers and to the people that I work with in my daily life that money is this huge looming thing. People that have enough money worry they're not going to have enough. And people that don't have enough really worry about how they can get the best care or live in the best place. So money drives a lot of the decisions, and it causes a lot of anxiety and a lot of overwhelm. And not always is it rational anxiety or overwhelm.
True.
So let's talk about money.
Okay, let's talk about money. So the one of the biggest fears, and it's legitimate, is I'm gonna run out of money before I die, and what's gonna happen then? Or I have wanted my children to have all of my money, so I don't want to spend any money on my care. So really, no matter how much money you have, everyone's afraid that they're going to run out or it's not going to be enough. So I love to get people talking about their money first, and then talking about their goals, and then helping them work up a plan where their money will pay for their care and their goals. And sometimes public benefits, Medicaid or veterans benefits comes into it. Sometimes it doesn't. Sometimes they're shocked to see that what they have is enough money.
They just need to know how it's going to work for them. And sometimes that takes a professional to help get perspective on the money and what can be done with the assets that you have to fund your best life moving forward.
That's right.
And accomplish your legacy goals.
That's right. And so, and knowing the cost of care, like how much does care cost? In Kansas, how much does it cost per hour? How many hours in a day can you get? Is there such a thing as live-in care in Kansas? Across the country, there is live-in, so that's another way to pay for care. But I also think, like, we teach people, care managers, teach people that if you want to stay at home, which most people do, you can create your own assisted living at home, which means you're hiring private caregivers. You can hire caregivers privately, you can get them through a company, you can get them through a nurse registry. You can buy by the hour, you can buy by the day. But it's important to look at what your local care costs are. And you usually start off with needing, maybe it's 3 days a week, maybe it's 5 days a week. And then you grow into 10 hours a day, maybe 12 hours a day. And when you hit the 10 or 12 hours a day, you're then looking at it being as expensive or more expensive than maybe assisted living costs. So it's at that point that people say, do I have enough money to go 24 hours, or is it time for me to move to a community?
So when people start getting in-home care and we're talking about maybe non-medical and home help, about 4 hours is usually about the minimum. Is that right?
Always, especially now with COVID, there's a caregiver shortage, so getting anybody to come work for you for less than 4 hours is just not realistic.
Okay, so wrap your mind around 4 hours.
Yep.
And 3 days a week.
Yep.
Would it make sense for some people to have less than 3 days a week?
Oh, I always feel like a politician when I answer that question. It depends. It just depends. So you're managing, caregivers want to work full time. So turnover with part-time caregivers is common. And it's a frustrating beginning point for people. Sometimes you only need it once a week. You need somebody to help you grocery shop, maybe set up some meals, maybe take you to the temple, take you to church, and once a week. Finding a caregiver to work for you 1 day a week might be problematic. So I like people to get their expectations in line, that they're going to have a little bit of a turnover until they get to needing full-time care, which is 40 hours a week. And when that happens, you've got a full-time job for a caregiver.
And so a full-time job for a caregiver might be like whatever hours you need, but typically what might it be?
I would say anywhere from 32 to 40 hours a week.
Where they might come in the morning and they're there till the evening, or?
Yeah, 8 hours a day, 5 days a week, 4 days a week, 10 hours a day. And then you have to also know your state, laws and regulations. If they're working privately for you, there's things that you should know to keep everybody protected, and using payroll companies and checking on the taxes and insurance. And that's the least expensive way to buy care, is privately. Getting through a company is the most expensive, but there again, you have workers' comp coverage, you have liability insurance, and you have somebody there that's going to find somebody if another person calls off.
Well, that's the big thing. You have a CEO, you have an owner of the business, you have managers, you have professionals that are helping provide the caregivers and the structure, because I would think for a lot of people it'd be awfully difficult to find their own person and hire them. But you're saying that is possible, perhaps.
Yeah, as a care manager, and you can go to the website aginglifecare.org to find a care manager in your area, but as a care manager, I'm really obligated to not have an opinion about which way to go. But what I like people to do or think about is, what protections do you need in place, and what are the risks to each scenario that you go on. And I'll give you an example where I advocated strongly for somebody to use in-home, the person that they had in the house. So we had a memory impaired client, and she loved her housekeeper. And that's who we hired as the caregiver, because that's who she knew, that's who she loved. We got her the training that she needed, and it worked beautifully. Now, was that wrong? Was that dangerous? Well, it was whatever worked to get somebody in the house, because sometimes somebody with a memory impairment, they don't want any help.
What about an adult child? Is it possible to pay an adult child that wants to do that and is a good match?
Absolutely. Absolutely. And there you have any kind of family dynamics. You want to make sure that things are documented, and that there is a will and what the will says, and that you have like the legal documents in order. And they're called advanced directives, which sounds like a really official word for, you need someone assigned to be your financial decision maker and somebody assigned to be your healthcare decision maker. Sometimes that person is one and the same. Sometimes it's called financial power of attorney. Sometimes it's called, the healthcare decision is called medical power of attorney, healthcare surrogate, healthcare proxy. But what you should remember is, it's a financial decision maker and a healthcare decision maker. So when you're not able to speak for yourself, they're going to decide what you would have wanted to have done.
And hopefully you've told them, you've prepared them for that, and you know that they're going to do what you wanted them to do.
Exactly.
So because some people just think, okay, I need a will, and that might be as far as they think, but it's very important to get the financial power of attorney and the medical power of attorney. Are there some other documents that often come into play?
Depending on where your money is invested or where your money is being held, you want to make sure that you are known at the bank, that your power of attorney is registered at the bank or at the investment broker, that people know who you are, and you've signed all the HIPAA forms to make sure that when there is a crisis that they know they can talk to you. I love working with estate planning lawyers. I love working with elder lawyers. They make sure that all that's taken care of. And the way care managers partner with the lawyers is making sure that whoever's assigned that healthcare surrogate job, that healthcare, that they are educated as to, getting taken off a ventilator. In my world, that's an easy decision. It's the mom's dying, she's in pain, do we give her an antibiotic? Is that life prolonging? There's more nuance to just, do we take mom to the hospital if she broke her hip and she's dying? They're more nuanced, but they're complicated and challenging. And like you said earlier, when you get all the way back to what does your parent want? I had a gentleman with early stage Alzheimer's, and he clearly told me and his daughter, it was my best girlfriend's father, that he didn't care what happened to him. When he got severely demented, he said, "Don't touch me, don't do anything." Well, what do you think happened? He fell and broke his hip, and he was in the hospital. And Carol called me at midnight. "What do I do?" I said, "You know what he said. Don't do anything." And so I hope I don't start crying, she had him discharged from the hospital, had him taken back to his facility, and he died 5 days later, and she's totally at peace. Now, the people at the hospital thought she was a little crazy, but he did say that to her. He did not want to be lying in bed, recovering from a hip fracture, not being able to follow the safety precautions and the information that the physical therapist would be giving him. So that's the kind of thing that you need some professional courage when you're put in these positions as a healthcare decision maker, in addition to needing to know what their budget is. What does their money look like? What can they afford?
So it's really important that you talk to your adult children or whoever is going to be in those roles, so you've empowered them.
That's right.
So that they're able to have that courage.
That's right.
And follow your wishes.
That's right.
So how else does money come into play? Because we've talked about getting in-home care, and there's a switch cost to, would it be now, is it better to move into an assisted living community or an independent living community?
Yep.
And in-home care is maybe non-medical,
Yep.
but you can also add in the healthcare component of it where you have medical people coming in to do certain things.
Right.
One, the in-home care, you pay for yourself, but the medical help, that's covered under your Medicare?
Yeah, people get Medicare home care confused with in-home care, and I like people to understand that Medicare home care is temporary. Medicare was designed to get you better. So you might be getting physical therapy at home under Medicare, you might be getting a nurse to come and do your injections for diabetes, and you get a caregiver. As many days as the physical therapist comes in, you get a caregiver. Well, that caregiver is in there for, I call them a drive-by bath. They come in, they give you a bath, they go to the next house. And when the physical therapy stops or the nursing stops, the caregiver stops.
Okay.
So it's 2 or 3 weeks at home. It's very temporary, designed to get you better. And what happens is people need the next stage. I've seen this often where they get home and they get all this care and they're stabilized, and then they have nothing. And then they get themselves in trouble, they're back in the hospital, back in rehab. So it's really important to go from Medicare to the next stage, and that's assisted living at home. And maybe, and I'll say this, financially, you say, I can't afford $25 an hour, I can't afford $30 an hour. Well, financially, I like people to look at everything they have available to them. Do they have long-term care insurance? Do they have a life insurance policy they can sell? Do they have enough equity in their home that they can borrow off their home? Do they have, are they access to veterans benefits? How does Medicaid work in your state? And sometimes, everybody says, oh, there's a 5-year look back. Well, there is a 5-year look back for Medicaid. There's a 3-year look back for veterans benefits. But that doesn't mean you can't do anything to plan. Elder attorneys are great at looking at your money and legally setting it up so that you can access public benefits in a timely fashion. And sometimes, like I love the lower middle income person that's, you think a couple $100,000 is a lot of money and it's really not. To be able to access Medicaid, whether you're at home or in a nursing home. And the other thing I would want people to hear, particularly the older person, assisted care is where you need to be comfortable spending your money. You run out of money, nursing home's going to get paid for. The federal government has made sure that nursing home care gets paid for, period. It's the assisted living at home or assisted living that is underfunded in most states. And that's where you need to get comfortable spending your money. It might prevent you from even going into the nursing home at all.
People worry about the 3-year look back or the 5-year look back, or they don't know about it and they wait too long.
Right.
Talk a little bit more about that, about the 3 years running out or the 5 years running out, and people being afraid, well, what happens when I hit a time period?
If you're the one that plans, if you're in that little percentage that plans ahead of time. I had one relative with his in-law moved money 10 years earlier. So when the 5 year came around, they'd already moved the money. She didn't have that much. She had $100,000. Well, that little pocket of money is paying for her private room in the nursing home. So they're sharing the cost with the federal government for her care in the nursing home. So it's not that you can't do anything, but that you have to have an attorney help you decide. And some people don't know your home is exempt under Medicaid rule, as long as you don't sell it. There are other exempt assets that you can have that don't count towards you being eligible for Medicaid. An attorney can help you decide whether your IRA is exempt, is your 401k exempt. And then are there vehicles in your state that you can use to, and I'll say move the money, it's not hiding the money, but it's planning for, so you have money set aside and you can share the cost of care with the government.
People might wonder, well, how can I leave money in my account to my kids or the house to my kids? Maybe I'll just put their name on the account or put their name on the house. What kind of challenges does that bring if you're not making sure you have an attorney helping you?
Oh, Lord have mercy. I just wouldn't recommend it. People will do things on their own to save money, and it usually costs them a lot of money in the long term. So I don't ever recommend going, I call it flying blind. You pay a little bit of money to get a consultation to learn what's allowable in your state, and then go from there. But don't try to go uneducated.
And how often would they use an attorney that they know versus that might have a general practice or has a different specialty?
Such a great question. That's such a great question. So I think, would you go to an oncologist for a stent to be put in? That's how you have to think about it. There's estate planning lawyers that do great at planning, but they don't know Medicaid. You do not want to go to a lawyer who has never done Medicaid planning. You do not want to go to a lawyer that's never done veterans benefits planning. You really want an attorney, and it's elder law. That's the title to look for.
Okay.
But talk around and find out who's helped you, who's helped friends of yours in the past. Look at their website and see what they've done. Interview them. How many cases have they worked with? How many clients? What do they charge? You can get a wide range of fees from attorneys for planning. And I like people to think you don't want to pay an exorbitant amount, but you don't want to pay next to nothing either, because you do get what you pay for. But yeah, look and do your research.
And a lot of people will also consult with a financial planner or a wealth advisor. So these are people that can really help you figure out how much money, or the money that I have, how long is it going to last?
That's right. That's right. And once you get your financial planner into the mode of, now it's time I spend my money, I'm not investing, okay, now it's time for me to spend. They do beautiful spreadsheets that give you the trajectory of how long your money's going to last. Then a lot of the financial advisors work with elder lawyers where they do the projection with when Medicaid will kick in and how it'll kick in. And then the care manager, I like to think of the team as law, money, and care, can help you with, if you go in this direction at home, you're going to use this spreadsheet. Your money's going to last this long. If you go to the nursing home, your money's going to last this long. And that the three of them work together as a team to make sure that your financial goals are met as you're paying for your care.
Then you can also say, well, all right, what if I want to go into this place where I pay a fee, an entrance fee to move in, versus I go to this place, it's this much money, it includes all of these things, or this place where it includes certain things and I might need to hire other people to help. And so there's so much to consider to understand what all your options are.
It's funny, as you're saying that question, I'm thinking if I'm an older adult, I'm already scared. Like there's so much, what does that memory care mean? Do you get memory care in the nursing home? Can you get it in assisted living? What's home plus,
Yeah, we're throwing
what's
lots
a
of
continuing
words.
care retirement, lots of
Lots of
jargon.
words.
Continuing care retirement community is an entrance fee based. And do you want to buy into an entrance fee based community at age 90? 70? Probably. 90? Probably not, depending on how much money you have. But I would not want anybody to go into that world without someone teaching them what each facility provides and what they're really buying into.
So when you talk about being scared and thinking, oh my gosh, the last thing you want to do is end up in an urgent crisis situation where you're deciding at the last minute. And you can make a lot of that fear, a lot of that anxiety go away by figuring out ahead of time. When people figure it out ahead of time, how do they feel?
Oh, I watch people. So one, there's the person that comes in and says, why didn't I know about you 2 years ago? Where have you been? And they're crying because they're so relieved. And then I have the people that come in ahead of time and they're peaceful. They're like, and the elder especially feels so relieved that it's all going to work out. And a lot of the anxiety comes from not putting it out to the light of day, writing it all down on paper, looking at the numbers. You know, reality is not that bad when you face into it. And
I love that.
Yeah, it's not that bad. It's the anxiety before you that is worse than the actual reality. But most older adults feel relieved, and many times I have my little box of tissue and I'm giving something because they're just crying. They're so happy.
Because that anxiety only comes because you don't have enough information.
That's right.
So if you feel overwhelmed or you feel anxious, you need to gather more information so you can have that calm.
Yeah, and see how it's going to work. And there's lots of different ways to finance care now that I would encourage people to investigate and look, because there's lots of creative ways to do it.
And you mentioned equity in your home, and it could be a reverse mortgage product. And just keep your mind open and gather information, and then you'll know what to do.
That's right. That's right. My favorite was Helen. She was 104. She ran out of money. We wanted to do a reverse mortgage on her house. Her financial planner went nuts. He said, don't do it, don't do it. I looked at Helen. She goes, I'm not leaving my house. She's 104. I'm not leaving my house. We did a reverse mortgage, and she lived a year, but she died in her own home. It was wonderful.
She was able to access the money that she needed to live there. And then when you pass, hopefully you still have equity. It's just a mortgage.
Exactly.
And you can still sell your home and get the remaining equity.
Exactly. I think reverse mortgages have gotten a bad rap. They now call them HECM, home equity conversion mortgages. They've gotten much better over the years. It is an expensive loan, but if your goal is to stay at home and never leave, I wouldn't leave anything off the table.
We've had people live on the reverse mortgage to a certain point, and then, okay, now it's time, we're going to move.
That's right.
But it afforded them that extra time.
That's right.
So, Amy, you referenced in your book about VA benefits. What would you like to impart to viewers about veterans benefits?
So 90 days active duty, 1 day during a wartime. So the military service is minimal. If you are a surviving spouse of a wartime veteran and you haven't divorced, it's definitely, and they had 90 days active duty, 1 day during a wartime, and you need medical help, meaning help bathing and dressing, go into your local area and find somebody who knows the veterans benefits, because it will pay for a surviving spouse $1,300 and change towards home care or assisted living. If you're a veteran, it's $2,000 a month.
Wow.
So it's not a little bit, it's a significant amount of money. And in some areas, in assisted living, you can combine veterans benefits with Medicaid. So it's a literal game changer for veterans and surviving spouses and for married couples. So I would definitely want people to learn about that benefit, because in some instances, it works like long-term care insurance.
Wow.
Yeah.
So we know that there's a way to be creative. You just gather information, and there's a lot of good information in your book, The Fragile Years. Thank you for helping us in Kansas and by being on Empowering Seniors.
Oh, thank you for asking me.
And thank you for watching. I'm your host, Katherine Ambrose. And if you have questions about this topic or anything else that we do, please reach out to us at empoweringseniors@kpts.org or call us at 316-686-4500. Again, I'm Katherine Ambrose, and until next time, this is Empowering Seniors.